Hi, my name is Erica Fierro and I'm going to be evaluating the spine. I'm checking for visible edema, any scars, moles, pimples, anything that can interfere with the nervoscope. I'm going to be putting the nervoscope on medium. I'm going to be turning it on, and I'm going to make sure that there is a tight seal cervical region. So right about there. Now I'm going to alrighty. Now I'm going to check there is a tight seal. Alright, and I'm gonna go upward the spine and look for a break. And there was a break on this area, so I'm gonna check. I'm gonna move the neuroscope 3 times up to further assess and look for the hot spot. Alrighty, and there was hot spot right there, and I'm doing it below where it made the signal. Now I'm gonna be checking for thoracics, so I'm gonna start and make sure I open these wide. Make sure there's a tight seal. I'm gonna go down, and I'm looking for a break as well. And there's a break right there, so I'm gonna check again 3 times. Alright, and there was a break right there. There's a hot spot. So I'm gonna move this up, okay? And there's a hot spot around here. Alright, the hot spot is right there. And you notice that there's also a pimple there. Alrighty, that's it. Alrighty, I'm going to be doing some static palp. I'm going to be starting off with the cervicals. I'm going to be palpating bogginess or feel on each side. On the cervicals, I'm going to go upward, feeling for some bogginess. I'm also going to be feeling underneath the spinous process for any pain, which is usually the bottom of the spinuses. Alrighty. Now I'm going to go on the thoracics, and from the thoracics you do motion, you palp downward, feeling for bogginess again. I'm also going to be feeling for pain on those spinuses underneath. Alrighty, onto the SI joints. I'm going to be feeling for any pain on palpation. Above is going to be indicative of a PI. Below the SI joints is going to be indicative of an AS. Around the SI joints, all around the SI joints is going to be indicative of an EX. And if there is deep inguinal pain, it may indicate an IN. Alrighty, now I'm going to be doing a motion palp for the occiput. I'm first going to test for laterality. I'm going to be between the mastoid and C1. I'm going to be laterally flexing, feeling for closure. I'm going to do the other side. And if there is no closure, that means it's restricted, and that's the side of laterality. Now I'm going to do P to A glide to test for spring and feel. If there is no good springy end feel, which feels restricted, that indicates a PI. And then now I'm going to be doing A to P glide. And if that is restricted, then that is indicative of an AS. Now I'm going to be doing the rotation. I'm going to be between master and C1. And I'm going to be going away from the contact. So rotating away from the contact. And I'm feeling to see if that's restricted as well. If that's restricted, then that means that the TVP or the occiput has gone posterior. Alrighty, I'm going to be looking for C1, C2. So C1, C2. I'm going to laterally flex, feeling for closure. The one that doesn't close is the one laterality. Alright, now I'm going to have him stand up. Okay, I'm going to have you close your eyes, and you're going to nod your head 3 times. Once you finish, then you're going to assume neutral position. Go ahead. Alrighty, then I'm going to observe his nose. If it was pointing superior, it would be an AS. If it was pointing inferior, it would be an AI. In this case, he's pretty straight. Go ahead and sit, please. Okay, and now we're going to do P to A movement. I'm going to be rotating, feeling for motion. If it's restricted, then that means that the TVP has gone posterior. Okay, I'm going to be assessing the cervicals. I'm going to first start off with assessing flexion and extension. I'm going to be in between the spinous process. I'm going to flexion and extend. And if the spinous process don't separate and flexion, then that means the superior portion is going to be posterior. Now I'm going to be assessing rotation. And I'm going to have my fingers on the spinous processes. And I'm going to rotate the head, feeling for motion. The side that doesn't separate is the side of, well, wherever the nose is pointing is the side of restriction. So in this case, this side would be restricted. And then now I'm going to be assessing the lateral wedge. So I'm going to have my two fingers on the side. Alrighty, and I'm going to laterally flex. And I'm in between spinous processes on the sides. And I'm feeling for lateral wedge closing. The side that doesn't close is the side that the wedge is open. Alrighty, now I'm going to be assessing SI joints. I'm going to be looking for the SI joints first, and I'm going to be doing the twist. And I'm feeling for motion. I'm going to go above the SI joint, on the SI joint, and below the SI joint. I'm going to go into the opposite. I'm going to do the same thing, twist it, feeling for above the SI joint, on the SI joint, and below the SI joint. The side that doesn't move is the side in question. I'm going to find the PSIS, and I'm going to have him bend down. Go ahead and bend down. Whichever one is the one that moves is the side in question, the one that goes superior. Go ahead and go back up. Now I'm going to assess I'm going to put my other thumb on the sacrum, and I'm going to have him kick upward his left leg. Alright, go ahead and go down. And if the PSIS does not kick back, then it is an AS. Now I'm gonna have him do the opposite leg. Go ahead and raise the opposite leg. All right, go down. And if the sacrum doesn't kick back, then it's a P. I'm sorry, it's a PI. All right. Alrighty, now I'm gonna be assessing glute height and glute width. Alrighty, and the one that's high is going to be an AS, and the one that's lower is going to be a PI. Now I'm going to be assessing the glute width. And the one that is narrow, it's going to be an EX, and the one that's wider is going to be an IN. Alright, now I'm going to be assessing the SI joint on the involved side. If I swing inward, it should open, and if it does not open, it's an IN. And if I swing outward and it doesn't close, then it's going to be a